also, I'm so honored and so happy to be opening this evening with a keynote. It will be about what I believe will be determining the future of women's health. Is the sound okay? Okay. So who am I? I'm a social entrepreneur by profession. In the femtech space, I founded my first company in 2011 when I was 25 years old in Copenhagen. It's called Ruby Cup, and it was the first menstrual cup company with a designated social mission to support girls and women in underprivileged situations to have access to safe and hygienic female hygiene. To this date, Ruby Cup has donated over 150,000 Ruby Cups to mainly girls and women in sub-Saharan Africa so that they can attend school or go to work without having to worry about their menstruation. And fast forward, 2015, the more famous Ruby Cup became. Melinda Gates tweeted about us. We won so many prizes, we're in the media. Many emails arrived in our inbox by women asking about their female health. So for example, "Hi Maxie, I have menstrual cramps. Do you know what to do about that?" Or, "Hey Ruby Cup team, I'm approaching menopause, I think. Do you know who I can talk to?" Or, "Hey Ruby Cup team, I think I have endometriosis. Do you know what to do about that?" And I asked myself the question, why do all these women ask Maxie, a business school student by then still, or a menstrual cup company, female health related questions? Why didn't they ask their doctors? And I started researching and I stumbled across this number 7. 7 minutes is the average consultation time at the doctor's office in Germany. So no wonder why people or women started to search online for answers or were contacting companies somehow related to the female cycle space. And what I found by then is what we today call the gender health gap. I continued my research, I found more shocking facts. For example, it takes 10 years to diagnose endometriosis and other health-related issues. So 10 years where women walk around not knowing what they have, in pain, not knowing what to do about it. I mean, you know the numbers, 1 out of 10 women leave the workspace while they approach menopause. And although we live longer, our lifespan is longer, we spend more time in bad health. Our health span is shorter. 9 years on average, that's a long time. So, with that, the idea of my second company, FEMNA, was born. And FEMNA I founded with the idea to give women easy, accessible online information so that they would get all the answers they needed for their female bodies. And today we improve women's lives at home, at work, and in the healthcare system. We work with large health insurers in Germany so that in partnership with them, women have free access to online health consultation, evidence-based information, peer-to-peer groups, and health tracking. And 80% of our users report that they feel healthier, more productive, and more energetic. We do this not as a replacement for doctors. I love our doctors in Germany. We do this as complementary to their work. So we basically do what they don't have time or the capacity to. And to this date, over 10 million women in Germany have access. That's over 30% market coverage. And I think our team, Esme and Tanya, we are all quite proud of this number. Yeah. I want to say though that my vision goes beyond entrepreneurial success. I want to create systemic change in healthcare because I believe that only healthy women are strong women, and only then can we achieve true gender equality. Yeah. I have to look at my notes now, sorry. This story might sound like a very success story. However, sometimes reality kicks in. And I want to illustrate that there's still a long way to go by a situation that happened to me 2 weeks ago when I attended DEMEA, one of the largest health tech fairs in Germany. I was talking to a woman working for a large health insurance company, one that my company FEMNA wishes to partner with. And she said she would love to partner with us. However, it will probably be difficult because senior leadership had said that female health, according to them, is a fad. A fad is in German Modeerscheinung. So they had called endometriosis, PCOS, menstrual pain, menopause a fad. And I've heard similar before. I've heard people calling it a niche, nice to have, or wellness. And I do believe that this is a very dangerous narrative because female health then does not get the priority that it deserves. And why should it get the priority that it deserves? So our Federal Minister of Health, Nina Wagen, she said, equal treatment in healthcare does not mean that we are all treated the same. Gender-specific healthcare is important to all of us, to all genders. But female health has been neglected and under-researched for centuries with the results that we see today. And next to the fact that it's obviously a personal tragedy for all these women, it also costs society trillions and trillions of dollars and euros because female healthcare is a core productivity lever. So what to do about this? Scientists are very clear, the path is clear. Sorry, the sound is weird, doesn't matter. So according to scientists, we need to think about 4 core things. 1, we need to count women. We need better data. We need to study women. We need to understand why diseases like endometriosis exist because only then we know how to treat them. 3rd, we need to care for women. We do have international medical guidelines, but due to the short time at the doctor's office, they sometimes just end up in the cupboards on paper. And 4, we need to invest in women. Health insurance companies need to put this topic on the top of their priority list. So the science is clear. I think above all though, there's another factor, and that is we need to think in partnerships. Partnerships. And I don't know if you guys are aware of the term and the concept of co-opetition. Co-opetition means competitors cooperating with each other. And according to Wikipedia, co-opetition induces systemic change, enables collective action to address industry-wide challenges. And I believe very strongly in co-opetition. I believe co-opetition is our superpower because yes, we are many actors in the field, some of us are competing with each other, are competitors. But instead of fighting each other, I think we need to all work together. So to conclude, what do I believe is necessary for better healthcare for women is A, you have to give this topic the priority it deserves. It cannot be dismissed as a fad. It is the prerequisite to gender equality. And second, I think we need to work together. We are a team. And so to conclude, I would like to finish off with a saying that I absolutely love. It's an African proverb and it goes like this. If you want to go fast, go alone. If you want to go far, go together. So let's all walk this path of female healthcare together. With that said, enjoy the rest of the week. Thank you.